coming for this important event. You know, in the life of any country, there are times we need to engage in difficult discussions in order to find solutions. So today it's part of that, starting a discussion in what has been a very systematic inequality that has been existing in mental health.
I'm at work, you know, trying to get on with my job, but even sometimes you could be doing the right thing, but sometimes that doesn't actually, I guess, hide the color of your skin.
What's interesting with epigenetics is if you think of people that have gone through slavery, and we're only talking maybe our great-grandparents, and for some, our grandparents' generation away, that actually the continual stress that they had gone through generation after generation can affect someone's genes and can affect someone's mental health, emotional health, and physical well-being. And I think this is important when we're looking to advocate for our community, because there's a sense of injustice that has happened, and there needs to be some kind of restoration.
Organizations acknowledge that there is a lack of cultural competencies and perspectives in their work. Commissioners are aware of equality issues, but do not, and I emphasize that, do not factor these into the decisions they make when commissioning services. BAME-led service providers are in need of capacity building and infrastructural support. And there has been an increased move to online services, which has created the need for infrastructure to support migration from face-to-face to online interactions.
But one of the interesting things I've noticed in my experience in visiting mental health hospital wards or units was how important people's faith meant to them in the midst of their crisis.
BAME staff are considerably, BAME staff more at risk of contracting the disease than other health staff. 11 of the first people who died within the NHS were from BAME background. And there's a whole, if you look at the statistics, over 60% of the staff that died in the NHS were from minority backgrounds. So we need to look at the data and look at the facts. So as we head into a second wave, we need to understand what the challenges are, and we need to ensure that we learn from what happened in the first wave.
So British citizens who came to build Britain better were regarded as profitable for the British economy, but have been underprotected by the government. This has been our history here for the past 70 years. And for us, the government has got this imbalance seriously wrong, profiting from us whilst underprotecting us and our well-being.
So we need to understand that these services need to protect us, and we need to demand it. Just like in the criminalization piece, we need to be active, challenging in the appropriate way, maybe peaceful protests, but we need to be collective. We need people power. We need that critical mass, so that in the end, these marginalizations and exclusions at the center of that diagram have to be changed. Because at the end of the day, I want to make sure that my grandchildren are not suffering the same inequalities and injustices, like this vicious cycle, as my children's generation have, my generation has, and my parents and great-grandparents have suffered.
Black community are so marginalized, and by doing this conference, I believe we have started the journey to speak out and to say, no, enough is enough. Let's have a change. If we make a small, tiny change like this, it will go a long way for tomorrow.